Welcome to Talking Shop, where we talk to different health and fitness professionals. And today we're speaking to Doctor of Physical Therapy, Angel Ortiz. All right, Angel. Oh, man.
What's up?
How's it been? It's been a good day?
It's been a long day, but I mean...
How's a typical day at the physical therapy office?
A typical day.
Go ahead. Just put me in your shoes for one day.
So it's very common in physical therapy practices to break your schedule into long days and short days.
Okay.
Reason being is it's most accommodating to patients.
Right.
So a typical long day at the clinic starts at 8 a.m. For me, it ends at 7 p.m.
Back to back.
Yeah, I mean, we get an hour break for lunch, but yeah, seeing patients all day long, some follow-ups, some evaluations.
Is there like a specific type of patient that you're seeing, or they're all over the place? Knee, ankle, foot?
So it's all orthopedics, but it could be all body parts. You know, so it could be a knee, it could be a shoulder, it could be a neck.
You see a lot of patients coming back from surgery, or...
So our general population is pretty like widespread. For the most part, we're seeing a couple of surgical patients now, but it's your typical people, your regular Joes like off the street, a lot of occupational type of injuries, a lot of sedentary like lifestyle injuries, stuff like that. But the most common body parts, low back for sure. Everybody has that. Oh, everybody's back hurts. Everybody's back
hurts a little bit right now.
Yeah, we'll be wiggling in this chair a couple bit.
Yeah, for sure.
So,
sure.
Shoulders and knees.
Shoulders and
100%.
Knees.
And then neck as well.
All right. So, what led you to that physical therapy field?
So I don't know if you remember because we went to high school together.
Yes, we did.
Right.
Yes,
but I transferred schools senior year. Okay. When I was at Coral Park before, I actually wasn't supposed to take a science class. My senior year, I was already done with my science credits.
Okay.
In transferring to Doral Academy, you were required to take a science as a senior, no matter what. You had to take all your core classes.
That's crazy.
Yeah.
I don't remember that.
The majority of seniors took marine bio because it was like the easiest of the sciences left.
I didn't take that either. Damn.
I wonder who knows what science you're still on.
I don't even know.
But I had already taken marine bio in Coral Park the year before. Okay. So when I transferred to Doral Academy, the only remaining science class was anatomy and human anatomy. So
amazing. Oh, what teacher was that? Grace?
Mrs. Grace.
Yes, Grace was amazing. Yeah. I had her too, bro. I love that anatomy class. I learned so much. Bro, that anatomy class instilled in me a love for anatomy.
Well, there you go. That's something we definitely share because that was it for me too. Like before that, I was headed down like a math field. I was always good at math. That was kind of like my thing. But I took that human anatomy class, senior year, kind of your thought process starts kind of changing.
Together. Or no? No, I don't remember.
Nah, I had like a 7th period class.
Oh, no.
You might have had it in the morning.
Nope. I had dual enrollment senior year, so I wasn't even.
Oh, there you go.
I wasn't even in school. I was gone after 1 o'clock. Done. Love it.
So, So I took that human anatomy class, and then I've just figured, what's a good way to do medicine. I didn't want to be a doctor. I didn't want to be in school for that long, and I was still in school for that long. And,
that's so true. That's so true.
And anyways, so I figured being around sports, all that stuff, the best career was physical therapy, and I never looked back.
Amazing. So you went straight on, and where did you go?
So after high school, I did 2 years at Miami-Dade, just for the associates. Yeah. Then I transferred to FIU to finish off my bachelor's. I majored in physical education, which they just wrap it all up as we had that
sports and fitness.
Fitness. We had that career together. Which it's kinesiology, little kinesiology, a little.
They changed it now to kinesiology, I believe.
Yeah, no,
they didn't.
Still physical education because shout out my sister, she just graduated with her bachelor's in physical education.
Amazing. Good job. Welcome to the club. You're coming next.
Yeah. So
All right, amazing, man. So then you finish there, you go into graduate school to be a physical therapist, and man, you really enjoyed the field. And what's something that you really enjoyed about the field that you saw that you were like, oh man, this is why I came here.
So it's always a career that made sense for me. You know, growing up, I played sports my entire life, and then once I got into the field, I was very comfortable with what I was learning, what I was going through. Being active, as you know, after high school, and you know, we all started hitting the gym and all that stuff. It was just something that always made sense to me, and then I found that it was a way for me to try to help people, which is as corny and cliche as it sounds,
For
you
sure.
know. But I think it's a cool career in the sense that you can affect people in a different light. You know, you're not going to convince everybody, but you know, the
Definitely.
important thing is, you know, it's a career, it's a job that's meant to empower people. You know, you're part of our job is get people less dependent on taking medication and taking, you know, more control of their body and
Right.
stuff like that. So I think that that's probably the coolest part of my career, and what I think, you know, is what I try to focus on the most, for
Perfect.
sure. So if that answers your
Yeah,
question,
yeah,
for
no,
sure.
100%, 100%. Is there, okay, so in your day to day, you see a lot of back pain, mainly. What's like, is there like a go to that you have for it, or do you have an assessment specifically that you make to assess for which area is the weakest or the most important for you to attack while at going at back pain?
So that's, you know, part of what we learn in PT school is when you take a patient through an evaluation process, right? And physical therapy evaluation is pretty simple. You know, it starts off with a structural inspection. You know, you're looking at somebody's posture, kind of, you know, where they're sitting in space. You're taking people through range of motion. You're checking their mobility, seeing how well they move in and out, checking the quality, not just the quantity of their motion.
Sure.
And then you take basic measurements, you know, range of motion. We have a strength testing scale, which, you know, as the years go on, it will no longer be used, but it's a manual muscle testing scale.
Yeah.
So you're pretty much grading somebody's isolated muscle strength on a 5-point scale, 5 being, you know, maximum strength.
Why do you say it won't be used?
Because it's a subjective scale. So, you know, there's studies that show that, you know, if you do a MMT scale testing on somebody and I do it, you might grade somebody a 4, I might grade somebody a 5.
The person doing the grading always needs to be the same. That's what it is.
Well, we try to keep it consistent, but, you know, nonetheless, one day it might be a 4 to me, one day it might be a 5 to me. It's not that it is, you know,
Right.
You try to keep a pretty consistent scale for the most part, but there's no way to actually quantify what you're doing. You're quantifying it through opinion, not through.
Right.
So what's commonly changing now is people are just replacing strength testing with like little dynamometers. A dynamometer is a small object that measures force. So, you know, technology is improving. We're getting smaller, more manageable ones. They relay Bluetooth, the results through Bluetooth through your phone, and you can get like, you know, concrete evidence as to how much strength someone is producing. Just the negative or the con is that it's time consuming. Right. So, which, you know, just me evaluating someone's strength through physical force is
faster.
Yeah. It doesn't take a lot of time. So, you know, it's like a double-edged sword, right? It helps out in that standpoint. Obviously, the more experience you build, the more you can learn to quantify it in relation to function.
For sure. Yeah. Because that's the most important part, is transferring that strength to the functionality, because a lot of people can have a strength in a movement, but they might not do it when they actually do a certain extension of the shoulder or arm, etc. Right?
Yeah, correct. So that's also part of where the evaluation kind of ties in the movement qualities, right? You know, it's seen often a lot of times that you're doing manual muscle testing on somebody and they're checking off a 5 out of 5, but you know, when you put it into a squat or into a deadlift or into a lunge, and then things have to now coordinate and work together, something goes off. So know, it may not necessarily be a strength issue. It could be.
What do you think? What do you think is like the main cause of that? You think it's a posture? Posture has a lot to do with it.
It depends. It's a little different for everybody. So, you know, the first question that led us to this conversation that we're in right now was, you know, kind of the go-to.
We'll take tangents. Yeah. This is a tangent ride.
So part of the evaluation process is to determine, you know, find some like root cause as to why this person is going through a pain experience.
For sure.
Right. Because the majority of people that end up in PT is because they're in pain. You know, no one just, or I don't want to say nobody, but
some
you know,
people should.
There are a few people that show up and are like, you know, I want to improve my squat, or I want to, or which, you know, I want to move better. You know, that doesn't happen often, but that is
the main idea of PT though. Is to do that. It's to do that every day. A lot of people think that PT is just when you get injured. Wow. And I think that it's more of like, you should be doing PT throughout your exercise career.
So that's actually like a funny question, because I think it ultimately comes down to definition.
Yeah.
Right. So
for sure.
If you want to get into technicalities of physical therapy, right? The definition is a therapy for someone whose daily function has been affected because of a physical limitation.
Oh, okay.
Right. So where, you know, people can live life through aches and pains. Right. But, you know, they're still working their 9 to 5 or, you know, whatever job. They're still playing sports. They play 2 hours of basketball and they can't take their knees for 2 hours, but, you know, they take a couple of Advils and they deal with it, whatever. And technically their functionality is not affected.
Correct.
Now, is there a role where we can serve as, you know, movement specialists and stuff like that? Not to say that we're some movement gurus or anything like that, but it's simply where the best trained, and those who care about being good, you know, therapists as well, to help someone identify kind of where their limitations might be and how to improve them.
For sure.
And not necessarily having to find a limitation, because I think that that's a negative as well, that some people might get into, where, you know, they're trying to find something wrong where there might not be something wrong. And, you know,
you see that a lot. You see it a lot where they're like, oh, we got to go here. And it's like, that's not even like the source. Like the source is, it could be the foot not properly pronating when walking, or not properly gripping the foot when you do the certain exercise. And man, sometimes I see somebody doing a squat and there's so just one little change that you can make to them. And, oh man, my squat is so much better. And it's like functionality.
Yeah, 100%. Yeah, I think it's definitely about giving the proper cues and stuff like that, you know, really helps. And understanding that people are different, because, you know, not the same cue or the same trick works with every single person. And a lot of it is tied into personality and behavior.
For sure. We got to deal. That's why, you know, like I wanted to go into the physical therapy field. That was my goal from when I started working. I loved, you know, I actually started as athletic training. That was something that I wanted to go into, but then I didn't want to be as a water boy. And I mean, not that they are, but that's what it seemed to me, because the practice was like, get there at 5 a.m. and go fill up the water coolers. Yeah. And I was so frustrated with that. I was like, yo, this is not what I want to do. I want to actually like hands on, but you got to do the dirty work to end up doing the heavy lifting. And I understand that, but I guess I was a little impatient. Regardless, in the majority of people that I have nowadays, they all have those issues where they're like, I have a knee replacement. I went through physical therapy, but my knee still hurts, or my hip now hurts, or my back is hurting. And it's like, could be the cause, the knee replacement, but there's so much wrong in their function that as a trainer, I mean, I have some understanding of it, and like, and when you go see them to go see a physical therapist, it's like they don't know. Oh, we already did physical therapy. That's what they say. Oh, I already did it. It's like, but you're not done. You're not done. And I don't think we're ever done until we're perfect. And it's kind of hard to be perfect.
Yeah, I think
it's practice. It's a lot of practice.
I mean, you nailed it. How do we get into a world where our bodies are moving perfectly and stuff like that? I mean, take us, for example, we're going to be sitting here for an hour, talking, and that's definitely not optimal for our bodies and stuff like that. So we're definitely fighting the constraints of modern society. A lot of people, everybody is aware that sitting is, the worst thing for your posture now and stuff like that. But like, to go to the example you brought up, when it comes to pain, and I'm not trying to go into a deep dive because we could be here for hours, but pain is just such a complex concept because it's an experience. It's hard to quantify exactly what's happening and why this person is experiencing these sensations. We can, kind of get to the point where we understand what certain tissues are speaking and, are the ones that are sending the pain signals and which receptors and stuff like that and blah, blah, blah.
Right.
But, if you tell me someone who had a total knee replacement, chances are either they played a lot of basketball for, decades, or, they didn't have great movement qualities to begin with. Things like that don't just happen just because on this, obviously, congenital disorders or anything of
any disease. Yeah.
Yeah.
But it's like, I was telling Jay when we spoke, and I was telling him, you can do one thing 1,000 times. 1,000 times that thing that you did, nothing happened. And that 1,001 time, it was like, oh man, I'm broken. And it's like, it wasn't that one time. It was every other time that you did it improperly. And it's hard to go into work in that perfect form, right? You can try to go to it as much as you can. And when I give cues to my clients, they're like, this is so much to remember. And I'm like, I know, that's why I'm telling you, so that you don't have to remember. I'm going with it with you. Good.
Bad practice never makes perfect.
Yeah, for sure.
Bad.
For sure. It will never. Yeah, you're right. It only improve you. But if you do the wrong thing 1,000 times, continuously doing it wrong, you're never gonna get it right.
No, 100%.
You know what I mean? So it's a hard field. It's a very hard field, and it's hard to sell it as well. A lot of people, they are more interested in, I want to lose weight. I want to get skinny. And it's like they care more about how they look than how they function. And that is just, to me, it's inconceivable. Like, I don't understand why would you give up functionality for looks?
I mean,
what's your opinion on that? What do you think?
I mean, people can be vain. People can be superficial. You know, I mean, we live in one of the craziest cities.
That's true. We're in Miami.
That glorify, based off of the majority of the relationships that we know are obviously the people that live in the city. And, we live in a city that glorifies, plastic surgery and stuff like that.
Yeah.
Do your thing. But it happens all the time, and I think the biggest mistake or the single-handed thing that holds people back is that they just don't understand how their body works.
Right.
For those that end up in the health field or medicine or physical therapy, something along those lines, are the ones that get exposure to it. But for the majority of people don't know and won't understand. So when you don't understand, it's much easier to make decisions against those things.
And just move forward, keep going
just move forward. Ignorance is bliss.
It is. It really is. Sometimes I do wish I didn't never learn that.
Yeah, I mean,
but I'm thankful I am.
It's a funny phenomenon that happens in PT school as you start learning more about, different injuries and diagnoses and stuff like that. Suddenly everybody in the class has, some form of some syndrome, some knee syndrome or shoulder syndrome. Shit. Everyone has a rotator cuff tear. And
I'll give you this. When I was 16, I was playing football and I got slammed. And I shortly after that, I couldn't run. I had a stress fracture in my lower back. Okay. I had to wear a brace for 6 months, 22 hours a day. And that was like one of my first biggest injuries in like So I've been injured my whole life.
Don't worry. We all know the big one.
Brother. And that was so bad because imagine I had to wear it even when I slept, that brace. And the doctor told me I was going to have back pain for the rest of my life. When he said that to me, I was like, no way, bro. No freaking way. I spent like a year. I never went to physical therapy. Never did it. Just wore the brace. After that, I started working out. That's when I really started working out. 2 years passed, and at 18, I wasn't feeling anything and went down a slope doing snowboarding for the first time. After that, felt my back like I never did before. Ever since then, I have never felt it again. And I've been playing football and I've been strengthening. But it was because I learned proper core bracing and how to activate my core correctly, moving all that stuff. So I feel like when you learn, how to properly move your body and how to properly get into alignment, then you're able to relieve all those sites of pain. What do you think is the toughest part about being a physical therapy when it comes to treating someone?
The toughest part, 100%, is having people stick through a 100%.
What do you mean?
So,
like follow through, stay true.
Stay the course for the entire tenure of physical therapy, and understanding that plan of cares are fluid. Plan of care is what we call, the time that someone is under your care.
Right. Yeah.
So
I'm a bad patient. I know.
So, I mean, that's definitely the hardest part, or just like I mentioned, getting people to just understand how things work. The most common thing that I hear is the doctor said I needed 12 sessions. Do you think I'll need 12, or what number do you think I'll need? I'm like, I don't know what number. I can't tell you.
It depends on you.
I'm like, I can give you time and I can give you an estimate, but like, I'm not a mind reader. Like, I can't see the future. Like, how long have you been in pain for? 3 years? I'm like, okay, this might take a little bit, like
sure.
You've been avoiding this chronic low back pain for a couple of years now. Like, I'm not a magician.
No, that's another thing. They think that, like, same thing with weight loss. It's like, I've weighed 300 pounds for 20 years. I want it gone in the next 6 months. It's like, whoa, instant gratification. That's where we at. That's where we at. And 100%. It doesn't exist. It just doesn't exist. I do know that in physical therapy, like, for sure. What do you think? Do you think that those exercises that you guys do, is it like take home and do them more often? You could do it every day, or is it like load management? What do you think about the specific? I'm talking about like the small range, easy exercises, the body weight ones. I'm not talking about heavy lifting or anything like that. Yeah.
We prescribe a lot of mobility exercises,
right?
Which, the quote unquote is just, to give a name to something to people so they kind of understand the purpose of what the movement is for, right? But, every single exercise, whether you put a resistance on it or not, has some form of mobility to it.
For sure.
But those low intensity that, aren't going to stress your main tissues out, those you can do, on a high rep range, high volume. And, as long as we're basing ourselves as long as you're having a positive response, then it's definitely okay to continue. Now, obviously, there are some people who need strengthening. The last thing that they need is, more stretching or more mobility, because they're already on that side, and, they need actually more strengthening to keep things stable and in place. You're not going to want that person doing a whole bunch of, hardcore strengthening every single day, and, they're experiencing muscle soreness, other negative effects, overtraining, whatever, however you want to look at it.
Right.
So it's case dependent, but there are definitely, a home exercise program. I think the overall message is just people need to understand that they need to move more.
More. Yeah, definitely. And not only move more, but try to make the quality movements. Mm-hmm. Not just go out, because I do get some people that come to my classes, for example, and they're like, I want to sweat. I'm not sweating. And it's like, exercise is not just about sweating. It's about getting your proper function, getting your proper good movement done. And sometimes you're not going to sweat.
Yeah. It depends what the overall purpose of the session is.
Correct. Yeah. I mean, I try to focus whenever I teach a class. I try to focus mainly on the function of everybody doing the exercise properly. If I see somebody that is struggling to even reach their arm above their head, I'm not going to have that person do overhead presses.
Yeah.
I think that's if you're seeing somebody that's doing this, it's like, dude, you should not be doing overhead presses. You could do arm reaches where you're trying to work on the functionality of the shoulder and trying to make it better, but don't get like now a ball and start tossing it up in the air like you're like you're back in your youth. You know what I mean?
It has to be a graded movement, especially I haven't done it in a long time. It has to be gradual increases.
Gradual increases for sure.
Body's not going to respond well.
No, for sure not. And like we said, like you can do the movement and maybe not feel anything, but there'll be it just takes that one rep that didn't go right, and then boom, now you can't even move that arm. You know what I mean? So it's really hard. And I know that this is the toughest part, is like getting it through the thickness of the skull of the person to tell them, oh no, but I heard this from this one. And it's like, man, there's so many people out there like laying out so much information. Yeah. And it's hard to.
You never know who to trust.
You're like, who do I trust? Do I trust that guy that's telling me this? How about listen to your body? You know?
Yeah, that's
the most important part, you know?
Yeah, that's the cardinal rule right there.
Listen to your body.
Does it feel good?
Does it feel good?
Oh, then do it.
Then do it. Go ahead.
Does it feel bad? Don't do it. I mean, 100%, like, especially,
it's hard.
Yeah. I mean, when you come to, like we talked about earlier, the subjective nature of pain,
right?
It's an experience. It's a feeling. A lot of times people with chronic pain forget what it's like to feel good. So,
sure.
A lot of times it's just about channeling your thoughts, your energy into feeling better, so that you know what it's like, and you can find yourself in that mindset and that mind state over and over again, because sometimes people are just down bad.
Yeah, there is a way to get to pain-free.
Yeah.
It just takes time.
Yeah, it takes time.
It takes a lot of time. Our body can heal, but we need to give it time. That's what I'm learning now. I'm not gonna lie to you. I'm pushing through it. It's been a hard 6-7 months right now, man.
30's been nice.
30's been tough, bro. I feel like I hit a wall, man.
Yeah, we're dealing with some stuff over here too. Us PTs, we're not invincible.
Nobody is. Everybody's taking some damage, and like you work with somebody specifically too. Whenever you need work,
every now and then. So I have the luxury. I am a clinical instructor as well. So
nice. So you
I get students. Students, and it serves them because they learn
for sure.
And then I get my
feel for.
Yeah, I get my fix in too. So
yeah, like stretch there. Okay, hold on.
Yeah, man. They gotta learn somehow.
All right, so that was the toughest. What is the favorite part? Your favorite part of physical therapy?
My favorite part, 100%, is when people buy in.
Yeah,
yeah, like when people like figure it out, and they have that little like light switch moment, the light bulb goes on. They're like, wow,
yeah,
this is starting to feel better. Or definitely like a post-surgical progression. That's always nice to see. Like, you get people, like you got a fresh ACL, they're bending their knees, 20 degrees, 30 degrees, 40 degrees, or whatever, at whatever time you get it. And then, out of the brace, they're starting to walk, things are starting to look more normal. You start seeing, the mood change a little bit, because most people are miserable in those first 2 weeks.
Bro, it's sad, man. Yeah, depression hits so hard. It's like, we tell them, you should move more. And it's like, when they don't move, they're depressed.
Yeah.
Move more. You're gonna, that's gonna flow out of you.
100%. So, but yeah, that's definitely the most rewarding part. I mean, and ultimately you deal with people, you get to build pretty nice relationships. For yesterday, we had our company party, our company Christmas party, and we had the pleasure of inviting some patients that have been with us for some time, for different ailments. They just want to come because they want to just continue working on getting better, and, whatever it may be. They're out of their pain cycle, but they just want to continue improving their function, or whatever it may be. And you meet a lot of cool people. So that's definitely also a nice little rewarding aspect of the job.
Yeah, for sure. No, seeing somebody that, or for example, I had someone And I mean, I'm not it by it, but in my field as well, like working with people that go from like, I had somebody that was in a wheelchair after a triple bypass.
Mm-hmm.
He did some PT, and then he just
Yeah, some
down,
people
down,
need
lazy.
some people
Bro,
need the accountability.
I got him to go on a walker, from wheelchair to walker.
Yeah, there you go.
And it was a long road. Obviously, it wasn't perfect, but man, that to me is very rewarding as well. Seeing somebody change like that, you know. Let me ask you, is there one part of physical therapy like that, if you were to work with one specific group of people, what would it be? Like a specific injury that you like to see more than others. I mean, obviously, we don't want to see any injuries. But at the end of the day, that's a job. It's fixing. Trying to fix. How about that?
Okay. To be 100% honest, that's a very difficult question to answer. Simply because everybody's different, you know. But I definitely like surgical patients.
Like what type of surgery? Which one? Any type?
Yeah, I like ACLs. I feel like every PT likes ACLs though.
Yeah.
There's
what's the main go to when you're starting with an ACL patient?
So usually the lifespan of a patient in your clinic, especially if they're going through their insurance, and they really stick hard to you're just going through the insurance. The typical lifespan is usually around like 3 months. By that time, they are not running yet, inching close to starting to run, but they're doing basically just a lot of like strengthening. Hopefully they don't have any deficits from the initial stages of ACL rehab, but that's usually at around the mark that they usually stop coming to us, which that's like a super unfortunate thing, because especially when you get younger patients, you get a college student who tore their ACL and playing basketball, right? And their insurance only covers them for 3 months. You understand they're in college.
Right.
They're not making a lot of money. They can't afford
the whole thing.
afford therapy, out of pocket. And that's definitely somebody that needs the physical therapy for at least some guided approach for, the greater part of that year. Because, if you want to just jump to quick timelines, they're usually straight line running around month 4 or 5. It is until about month 6 that they start cutting. And then return to sport is anywhere between 9 to 12 months.
Yeah.
So imagine someone getting a third of that.
Yeah. And then wanting to return in 8 months, like they're Adrian Peterson.
Yeah, 100%. I mean, that's where the majority of re-injuries happen, which is, the unfortunate part.
I think that when you have like young athletes like that, they don't realize that these pro athletes did the physical therapy the whole time, and even after.
Yeah, 100%.
They completed that. They got cleared to play. They were still doing physical therapy exercises outside. You could see them on the sidelines doing some of the exercises.
I mean, everybody right now, the huge talk is Aaron Rodgers and
his Achilles.
And his Achilles and the progress he's been able to make. And 100%, Aaron Rodgers is on his ayahuasca crystals and defying the laws of science. But
I haven't seen it, but he's doing the work, just extra workup.
Yeah, 100%. So like exactly what we're getting at. Sure. He got an advanced procedure that typically isn't done to your average Joe.
Right.
And you mean to tell me Aaron Rodgers not getting physical therapy
daily?
Every single day,
twice a day, if anything, maybe like
in the early stages, for sure. Manipulation,
some scraping, immediately movement, 100%. Manual movement, exactly. Like, bro, it's so much, and they're like, oh, he did it, I can do it. No, man, you gotta understand that these people have the means to afford to get all that treatment, and 100. It takes a lot of treatment to get there. Same thing I see with like hamstring pulls, for example.
Yeah, those are tedious.
Oh my god. Yeah. I don't know which one I hate more, the hamstring or the groin.
So like there's a huge...
I hate the groin specifically too. The groin is where I'm at.
I don't want to say huge controversy, but the way that like something like a nagging, hamstring issue, right? So that's one of those perfect examples where, you'll want to end up in the right hands, or just making sure that someone's properly assessing you. Because a lot of times like, oh, you got a you're pulling your hammy because your hammies are tight. Your hammies are tight. Your hammies are tight. You go, you do like
stretch.
Yeah, stretch. You go do a flexibility test, and perfect flexibility. So then it's something within the movement, right? Like what's happening? Are you favoring one side? What's happening as you're going through that phase while you're running? Are things lining up correctly? Why is your hamstring receiving so much of the
load?
The extra work.
It has to do with the gait. So you have to watch the gait as they walk and as they run.
Yeah, and you have to look, above and below the chain. You gotta look at the hip, you gotta look at the ankle foot, you gotta look at the core. A lot of hamstring issues are actually core issues. They're not hamstring issues.
Core issues. So like stomach core, like adduct. I mean, sorry, like abdominis, all of that stuff. Really,
stomach core issues. Yeah, 100%.
What? No way. Why? Why? I mean, obviously you don't want to give away all. You're not just kidding.
Nah, man, it's super simple.
All right.
This is my phone. If we could imagine that this is your pelvis, and this is the front side, and this is the back side. Okay. Right. When you're in an excessive tilt forward or
anterior pelvic tilt. Okay.
And because you have weak trunk flexors in the front. Yeah. Right. Your hamstrings here on the backside are over lengthened. Right. Right.
So it's not that they're
tight. both your hamstrings and your abdominals work to posteriorly tilt. Mm-hmm. If the front side is weak, and if we look at the abs, they're smaller muscles. We look at the hamstrings, big, powerful, strong muscles. Right. These are going to work double time to help stabilize your pelvis during the gait cycle.
So that's why they strain, because you're working harder.
So people are like, oh yeah, just strengthen your hamstrings, Your hamstrings are literally two biceps, right? And literally, you never looked at the core.
Never looked at So, but not just the core. You got to think about the pelvic floor, the pelvic floor as well. I think,
you got to look at everything. You know what I mean? But that's just a quick little example,
a little snippet. No, which is just by realizing that, like I can picture it in my head. Like you put the phone, and in my head, I envision the whole body.
Probably for the common viewer at home, probably not the greatest example.
They're like, I just see a phone, I just see a flat surface.
Yeah, like, I don't know what this guy's talking about right now.
No, but it makes sense. It does make sense because definitely, I see it in the people that usually have, like, they can touch your toes. They're like, man, I can touch my toes. Yeah. You test their hamstring, and their hamstring is strong. They can do it.
Yeah, core. And it's their core.
So then prior to a game, it would be good to do some core activation.
100%.
That's good. I'm going to start adding that to my repertoire.
Some core activation. That's like
we all learning.
That's like the powerhouse right there. Like the core. Your core. Like
it's so important.
It sucks. Everybody hates doing core.
Nobody works it. Everybody goes to the gym and they're like, yeah, no, we don't want to do core. I will say this. I think every exercise is a core exercise. You can make it a core exercise. Every exercise. They also are because they're active. But I think since we do so much exercise of like with a resistance, like with an assistance, I mean like laying down on a bench or with something holding our back, that already puts our core in a favorable position to not do shit.
Yeah.
You know?
Yeah, I mean, basic like bodybuilding exercises and stuff like that, which in reality weren't meant for functionality.
No, they were meant to just lift big heavy weights, and everybody's like wants to hit the bench.
Yeah, it's meant for aesthetic reasons. Nothing else.
I know. I had a client that he was just be like, I want to hit the bench. I just want to get big, and I'm like, you need to get on the cables and start pressing on the cables first, and it's just. It's hard. It's hard to.
Some people can't get out of the paradigm they live in. But it is what it is.
Again, it's all that's being sold, because I was telling this to Jay. I do blame. If I were to pick a place to say this fault is not just people liking to just I look pretty, but it's because there's so many people that are selling. Oh, just get big. Just get look skinny. Just those people that are selling this is what's getting people away from true function, you know?
Yeah, I mean, 100%. I think aesthetics definitely is always going to be at the forefront. But with the same right, I want to say that our society is becoming a little bit more health conscious and stuff like that. The new craze. I mean, I guess I want to say the new craze with me because obviously we get bombarded with a lot of fitness related stuff on on social media and whatnot.
Yeah,
but everybody, the new thing is the cold plunges and
the cold plunges.
What
do you think about the cold plunges?
I think it has its time and its place. There's evidence that shows that it has positive effects on your. It was funny. I was literally having this conversation today, but there are studies that show it has positive effects on your body. There are also studies that show that if you do a cold plunge after a workout, it can have negative effects on building muscle. For sure. Right? So there's a time and a place. Now, you can cold plunge all you want. If you don't get your 6-7 hours of sleep and good quality sleep, like forget about it.
Sleep is so important.
It has to be balanced. What are you eating? Are you hydrating? And it's not that you have to go cycle and cover all bases, but try to just be the 80-20 rule. Like try to be as good as you can with everything. Make sure you get some decent sleep. Don't eat like crap.
Right. You talking about Subway because I had it earlier.
Nah, man. Listen, you can have Subway once a week.
Or every day. Bro, let me tell you, college, that was lunch and sometimes dinner every day. I had a little card from Subway that was buy one, get one from Core Park, actually. That one of my boys gave it to me.
There you go.
And that was lunch and dinner with my boy Kyle every freaking day, man.
I have my Subway phase too, but I grew out of that phase. I didn't want to be like Jared anymore.
Like Jared.
Pause.
Did he lose it or gain it through Subway? They got it before and after backwards.
Nah, bro. We don't talk about Jared. Bunch of sketchy stuff came out about that guy after. So
yeah, we won't get into any of that stuff. This is strictly that. But man, I really appreciate you coming in and helping us, just learn more about not just fitness and health, but the physical therapy aspect of it and how important it is, man. Because I think a lot of people overlook it, even though they're like they how do I say it? The word is they hate it. It's not they hate it, but it's more of like despise going to physical therapy.
People don't want to. People, and rightfully so. We live in a hectic life, especially here in Miami, and people don't want another obligation.
Right.
I think that's what the forefront is. But, the way that I at least try to combat that is people believe or come with not all of them, but come with the preconceived notion that I'm supposed to fix them.
Yeah.
Right? And it's that I'm not supposed to fix you. No, you fix yourself.
Right.
My job is to give you the tools, right? And help aid that process through.
You fell in a hole. I'm throwing you the rope and I'm helping you pull up.
Yeah.
But 100%. If you don't grab on and if you don't step by step and pull, you ain't going nowhere.
100%. I mean, and it always shows like, the people who are consistent, the ones that, that believe, the ones that understand and, have some motivation to get better, they get better. It's without a doubt.
What bigger investment to make than to your own body?
Yeah. I mean, it's unfortunate because, and, I think a lot of us are guilty of being that way, but it isn't until you have I'm
the number one guilty party. Okay.
Yeah. It's not until you have a scare or you're going through something that then, priorities start to kind of line up. I think we can do better as people of being a little bit more proactive in that sense. And it doesn't mean you have to be perfect. It means you just have to take,
step by step.
Yeah. Take one step, be just a little bit more conscious of your habits and stuff like that so that you don't have to end up in physical therapy.
Right.
Even though it's fun.
Do you think that physical therapy should be a little more, what does it say? And it's hard to put it because we obviously want to make our bread. But do you think it should be a little more affordable to the people?
How do we put this? I don't want to say that it should be more affordable because, and I think that's what we're going to start seeing in a couple of years is I think physical therapy is going to become a service that's now being seen outside of your commercial health insurances, right? Because your typical health insurance covers specialist visits and you have dental insurance and whatnot, but you make those trips, how many times you go see your PCP? Once a year.
Yeah.
How many times if you have to go see a gastro or a derm or whatever it may be, you might see them once, go for a 2-week follow-up, go for another 4-week follow-up, and that's it. You saw them 3 times.
For sure.
I mean, you got to go to physical therapy and you have a pretty nasty injury. I'm probably seeing you 8 to 12 times in a month. Right? So that's
like not enough.
Right. So I think that's where things are changing, where I think eventually what the type of system that we're going to see is physical therapy will be its own kind of insurance, right? Especially for people that, are maybe prone to injury or work or whatever it may be, where it starts. And that's the route where it'll become more affordable.
Can you do a physical therapy class for a group, like a group class? If you say like, oh, low back, shoulder, knee, foot, ankle, hip, neck.
Not really.
Not really.
Like you see multiple patients an hour. Most clinics do. Everybody has like their own individualized case. And it kind of goes back to what we talked about before. For you to be a candidate for physical therapy, there has to be some effect on your function, right? It's not that you're going to go so that we're just, making our shoulder feel a little bit better.
Right.
And stuff like that. Like, you have to technically have some sort of physical limitation to be like an appropriate candidate for physical therapy. That limitation could be like, I can't get through my workday because my back hurts. And it's like an 8 out of 10, 9 out of 10 pain, which is valid, right? Because, it's affecting your productivity, however it wants to be justified. Mm-hmm. But it's not meant to serve as a class or whatnot, because that's not its true purpose. Right.
It's obviously it's individual to the person because everybody's going to have different function. Like you're going to have, some people have low back pain because of a posterior pelvic tilt, not from an anterior. Some people have it from an anterior,
Everybody's a little different.
Everybody's a little different. So, but what I mean is in the sense of, because do you know about the Move You guys?
Yeah, Move You. Absolutely. They're very popular in the movement science space. Yeah. So, which it's all like it's a very deep conversation in the sense that, we get into definitions of physical therapy and then you get into definition of exercise and it's all really just the same thing.
It's the same thing.
It's the same thing. Like you helped one of your clients go from a wheelchair to a walker. You're not a physical therapist. You just did probably the most logical thing, which is, let's get stronger. Yeah. Right. So that's where
his exercise was get up, sit down.
Get up and sit down.
That's it.
He'd be doing that at physical therapy. So I think it boils down to people just something we mentioned earlier, understanding their body a little bit more and not, putting everything in the box of this is an exercise or this is this or this is that. Right. Just understanding maybe like the basic rules of their body. Let's take my body through its range of motion. Let's do something to stimulate a little bit of strength adaptations, stuff like that, where it's now no longer like a physical therapy class for low back, right? It's just more like a training session where you understand, hey, these are some exercises that are beneficial to me and my situation. And, maybe my core is a little bit weak and I need to get a little bit stronger, or, I need to learn to squat a little bit better. And it's limited because I have some movement limitations in my hips or in my ankles or whatever it may be. Sure. I wholeheartedly believe, and this is something that I learned at one of the previous clinics that I worked at, which is a concept that I had never really heard. But the same way that you have a PCP checkup and they go check your vitals, which, for the most part are pretty good. For the most people, people should be getting annual physical evaluations. How good is my physical functionality? Right. Because once your physical functionality starts going out the window, everything else goes out the window.
Oh, absolutely. Have you seen the videos of how PE used to be back in the day?
Oh, yeah.
When people used to exercise
guys
like
are
crazy.
Just busting out pull-ups like it's no one's business.
Our PE teachers need to be in that in that sense of understanding functionality.
Yeah.
I do believe that we have struggled in that part of education as well.
I mean, but let's not
But
get into.
I know. I don't want to get too political as well.
No. That's not what I'm saying. I'm saying, PE online. Like,
I know. There is no such.
No, there is, man.
I know there is. I know
But
there
like,
is. But it's just terrible.
Online. I mean, bro, that's the world we live in.
And now we
PE
live in
online.
the online training, which I don't completely disagree, man. I think it's a good way to help everybody get active, because you and me, we physically cannot, like, I can see at most 20 patients in one day, and that's overworking myself, like killing myself, right? Like, we're not meant to see everybody in the world, right? We're meant to use everybody around us, teach them as much as we can, and help them go out and do the same that we do. I think that's our main goal, what it should be, at least, because we're not going to be able to take everybody in, And I like the online training, but I do believe that being able to see the person's function and being able to make the person aware of their improper function and how to get right into moving properly should be the most important thing in any online program.
It's such a difficult world.
It is.
We want people.
It's a hard knock life.
Yeah, we just want we want people to move perfect. And, also, the more that time passes, we understand that there's, not a single approach. Like the same way not everyone was meant to squat the same.
No.
Right. So
yeah, short femur versus long femur. Yeah. Man, when I learned that thing, I was like, wow, now I understand why that person drops his chest so much. I understood things clearer.
So I think it goes down to that, where understanding that certain strategies may be a little bit more specific to some people than others, and more beneficial to some than others. So I think that's where, like I mentioned earlier, that's where we're simply just providing the tools for people to understand what works best for them.
For sure.
Now that's just 50% of the battle. The other 50% is these people need to actually, grab these tools and do something with them.
Do something with them. Correct. You guys, you need to become carpenters. We're giving you the wood, we're giving you the hammer and the nails. Y'all need to build your chair, because it's ain't nobody gonna do it for you.
Yeah,
that's life. And we can talk all night about all this topic, and I know that this is something that you're passionate about. And again, man, I can't appreciate more from you to come here and give me an hour. I know that it's a lot, especially after coming from work after. I can't even count how many hours. That's more than...
It was a 10-hour shift.
10-hour shift. Jesus.
That's okay. People getting better. That's what matters.
That's all that matters. And look at that. And you're still here to provide the content for the people, man. Yo, thank you, Angel. Guys, we're going to go ahead and end it here, because if not, we're going to keep going all day.
All right, man. For sure. It was fun.
I appreciate you.